Yes, welcome back to the Magic Sponge podcast, a miracle cure for all your rugby league injury issues. I'm Brien. I'm the guy behind all the NRL Physio content you see on social media. My co-host James, you are here, mate. It's Sunday night. We always usually kick off the show with talking about how our teams went this week. I obviously want to avoid that topic completely. So what I'm going to talk about and throw you with is how about the boys making headlines on news.com again this week. Even with we threw the line out, we thought it wouldn't get taken, and we're back up there. The ticking time bomb lives. Hoops must be rolling over in his grave on the car bonnet. I don't know, but it's just good. It's good to have ticking time bomb back, and I'm happy about that. Let's not talk about the Finns.
Yeah, your quotes are always going viral, Brian. So you know how to put something up in lights there to get the sponge up in lights as well. But yeah, I guess overall, Brian, like it's a reasonable week for yours truly. Actually, my son turns 2 today as well, so I've had a bit of a busy day today. I didn't get much of the Sunday games in because of his little celebrations, but useful week all round, and obviously a bit of carnage in Supercoach. So I think the thing I love about Supercoach, Brian, we've talked about this a bit off air, is like you just want to like not have as bad a week of Supercoach as someone else you know. It's and just like there's something really just thoroughly enjoyable about like everyone has issues, like everyone's got team issues and who they've got and injuries and things like that. But you're like, oh, but if someone has it worse than me, then that makes me feel really good. So for everyone listening there that has a good team at the moment, and for the people that suck, like there is that discrepancy, and it is funny. But it is one of the things I like about Supercoach. I've got to say, Brian, yourself.
Yeah, mate. Look, I'm a proud subscriber of the SC Playbook. Shout out to those boys; they do wonderful things with Supercoach, and I'm in like the WhatsApp chat, and I'm sure there's a few listeners of ours who will also be in there. And it was, look, he's a good friend, the Spy, Supercoach Spy, but he sold Garrick this week, and he was melting down in the WhatsApp group, not happy, Jan. And look, like completely can sympathise with him. I think Garrick definitely floated across my mind to sell this week or even next week potentially. So, yeah, look, as you say, it definitely does bring you a bit of a warm feeling in your heart when you see somebody else struggling more than you, even when he's a good fella like Spy. So shout out to him.
Yeah, Spy's in the Invitational for one of
Yeah.
our draft leagues as well, isn't he? So obviously, firstly, sincere condolences on your trade, but also sucked in massively because that's super funny for everyone else playing along at home. So he's a good fella, Spy. And he's good for the draft comp. Actually, he's going right.
Yeah, 100%. Actually, on the draft comp note, I started that 20-man league, the Magic Sponge. We've got the 2 invitationals, but this was like the experimental league to see how the 20-team com went. It's going really well. The boys are all really involved, which is great, where there's a few trades rolling around, which is good to see. But one of the fellas today, I think it was Jaden, his name was, rolled me. I'm like 0-3 in the league, so we won't talk about how my team is. I drafted Tom Duffy in the 4th round, which for a 20-team league, it was like pick 80 or something like ridiculous. But yeah, that's not going well for me in a league where halfbacks obviously are pretty low. So yeah, but shout out to Jaden, well done. Yeah, commiserations to the Spy. Sorry, mate. But let's move on. Well, look, guys, you know why you're here. We're the one-stop shop for all things injury analysis in the NRL. Check us out on YouTube. Subscribe to us on there, on Spotify as well. The more you subscribe, the greater it goes for us in terms of getting the show in front of more people, which is great. All right, let's get into the injury wrap for this week, which is brought to you by PainPod, drug-free pain relief anyone can use.
I don't know exactly what he's done. I would have thought it was an ankle, but I'm just guessing.
He shouldn't be out for a long period of time. I'm no doctor. We have to wait for the scans, obviously, but that'd be more positive than negative.
HIAs again to begin, Brian. We might just breeze through Nelson Asofa, Solomona, and Morgan Smithies because there's less fancy relevance with them. But the ones we want to talk to in depth are Nathan Cleary and Connor Watson, aren't they?
Yeah, mate. I think Nelson, the only one I think I'd mention there is, once again, this is a bit of an interesting case in that he failed a post-game HIA. So I think I assume it's from that head clash with Nick Meaney during the game where Nick fractured his face. Nelson obviously passed on field testing, all that kind of stuff. So just worth mentioning once again, we talk about it all the time, but just the ever changing nature of concussions. You can have guys pass tests on the day, then fail like that night, the next day. We had Will Warbrick from the Storm. He was a surprise kind of omission from their team, even though they had the bye in round 2. He's apparently having lingering concussion symptoms from, I assume, from round 1. They didn't mention a training concussion. So yeah, look, ever changing. Moving on to the fantasy relevant guys in Cleary and Watson. Once again, ever changing. Ever changing environment with both of these guys. They both had category 1 clear concussion signs. That doesn't necessarily mean it's going to be more severe or require a longer recovery, but it means that they have to sit out the 11 days. So they both definitely miss this week. Mate, my big toss up, and I'll talk about it in depth later on, but Cleary is a real sell option for me at this point in time. He's going to drop a bunch of cash. He's definitely going to miss next week, in a week where I'm missing Callum Ponga as well. If I need to trade out Cleary to fund some other trades, and I've got a few guys, trading Cleary out for a few gun guys, you've got with the movability in my team, I can potentially trade out Cleary for guys like Paps or Jaden Campbell and these kind of guys. So I'll throw to you, being our SuperCoach expert, mate. What do you think about the Cleary trade call? We're early in the season, but I'm kind of leaning towards him being a trade option at this point.
Yeah, would I do it if I was a Cleary owner? I don't know if I would, to be honest, but I can see your point of view. Especially if you're a Metcalf owner and you can slide him up to 7, and you can bring in a 6 like Campbell or Munster or someone like that with a fairly high ceiling. Or if you can even get to a Papenhuyzen, that's a pretty good win with the money saving as well. Obviously Cleary's going to drop a little bit now, but he's got the 2 rolling through his average as well. So I guess when you think back to last year, Brian, we had this similar sort of circumstance with Nicho Hynes, where Nicho was he sort of in the high 9s or nearly the 1 millions? He had a low score, and then that rolled through his average. And then I think he had his ankle syndesmosis injury after that as well. So not only did he shed multiple hundreds of thousands of dollars, not score that well, shed heaps of cash. It was a pretty good learning opportunity, I think, for us both, because we're like, no, just stick fat, just stick with him. He's got a good draw coming up, and then anything can happen, as it did. That was a big learning one for me. I was like, if someone's got that lower break even and they're going to shed, north of 200, it could be worth moving him on, because, if you're going to pick him up on the swing, he's probably going to be much more affordably priced, and you can move a variety of people with your team options as well. So that sort of makes it, to me, a bit more of a no-brainer.
Yeah, no. Oh, look, I've got no concerns with Cleary when he comes back in terms of, return to performance or anything like that. Just kind of being early in the season, I've got 40 plus trades. I'm happy to make some moves. So that's kind of where I'm sitting. We'll talk about that in Supercoach Corner. But I mean, similar with Connor Watson, I think his break even probably won't be as bad. Don't quote me on that, but I wouldn't be against moving him on if you needed to make some moves on some guys with lower break evens and those kind of things.
Very good. First game of the round was Storm versus Panthers, Brian. So Daine Laurie was ruled out with a quad injury. Jahrome Hughes was ruled out with a broken hand. Nick Meaney, facial fracture, as mentioned before. Grant Anderson with a knee injury. Bit of a weird mechanism for that one, but it looks like he's avoided the nasty ACL combination there. Ryan Papenhuyzen and Eli Katoa were limited in terms of their information, but they have very big Supercoach implications. Ryan Paps with an ankle that I think Bellamy said was a bit crook after the game, and then Eli Katoa with a knee concern, which kind of had that medial stress to it by mechanism, but we don't know a lot about those guys, to be honest. I guess starting with Daine Laurie, Brian, we're probably not expecting a long absence there for his quad injury, I'm assuming.
Yeah, no, he's hopefully a good chance. Well, if not next week, then the week after. Big blow for any drafters who picked him up especially as a number 1 waiver in many of my leagues. I think a lot of guys sort of spent that. Yeah, there you go, yourself included.
Yeah,
so
I spent 2 on it. Yeah,
oh mate,
happy about it.
Yeah, mate. So not much, what can you do there? That's pretty rank. So, but yeah, so at least you should have him next week or the week after. And then Jahrome Hughes, broken hand. The Storm say they expect him to miss 2 weeks. A lot of people have been asking, how 2 weeks? That's crazy fast. We've seen this heaps of times, and you'll often see me put, when I first hear broken hand, I'll say like a 3 to 5 week return to play. And a reminder that, especially in the physio world, and when I post a lot of the time, when I say 3 to 5 week return to play, a 3-week return to play is missing 2 weeks and then returning on the 3rd week. So we see it all the time. Like it's the surgery in a lot of bones in the hand stabilizes that fracture really well. It allows guys to kind of get things moving really quickly, especially if it's a small fracture. Get the plate in there, a plate, a few screws, and away they go. So we see guys return on that 3rd week, so missing 2, coming back the 3rd heaps. Nick Meaney with facial fracture. I think the important distinction here is that it's sounding like it's more cheekbone, potentially eye socket as opposed to jaw. Funnily enough, we do see guys come back quicker from cheekbone injuries compared to jaw. Jaw is usually around that like 5 to 6 weeks best case, whereas we've seen some cheekbone fractures come back as quick as like 3 weeks. So the Storm have said 4 to 6. So I'm still like, Paps is still a buy for me this week. He's got a negative break even. Even if Nick Meaney misses 3 weeks, I'm still confident in Paps being a good buy. Overall, if let's say, just to throw to you very quickly before I run through these last few, let's say Nick Meaney, we know for sure, and we're not going to, but let's say you knew for sure that he was going to miss 3 weeks and come back on the 4th, would you still think Paps is a trade in?
Yeah, I do. Yeah, I like him at price, Brian, I think. And, you can go down to him from so many players. And I think the upside there, as he showed in week 1, is enormous. And if he's goal kicking, holy hell, he didn't kick all the last year and he still scored reasonably well. That just adds, conservatively 8 to 10 to his average. It's pretty damn good at the position.
Yep, no, completely in agreement. Grant Anderson with the knee. I had a lot of people get on the text to me there. It was a big game. I think most people were watching, and got a lot of textbook ACL, those kind of things. And I was really happy with my injury analysis abilities there, James, in kind of not flying off the handle. Sent back a few texts saying, "Oh, it's not quite textbook," because it wasn't that typical plant the knee and then plant the foot, the knee collapses inwards. He had that hyperextension. We've seen time and time again, and I think I've said in the past on this show, hyperextension injuries are one of the most wide-ranging outcome mechanisms that we see, in that with hyperextension, you can have bone bruising. And I mean, we saw it with Grant Anderson here. He was in extreme pain, came back later in the game. And you can have that. With hyperextension, you can also rupture your ACL, PCL, PLC. There's a lot of things you can damage as well with hyperextension. So they are a bit unpredictable, but it obviously saved Anderson here. We saw one of the Broncos forwards. He had a nasty hyperextension injury in the preseason. Came back just bone bruising. Not that that's bone bruising can still be. I think he only returned the weekend just gone, so it still can be 4 weeks out, depending on how bad the bone bruising is. But thankfully for Grant Anderson, he was okay to return, but the one thing I would say with that is it can get a little bit more sore in the days coming. So potentially he might be a bit touch and go for this week. Perhaps with the ankle, look, at the time, it didn't look great. It was on his right ankle, so the ankle that he had previously hurt. It's come out that he's been cleared of any major injury. I guess the big thing there is, because it's on the ankle that he's previously hurt, he's got a fair bit of scar tissue around there. So if he tweaks something, scar tissue just can get tweaked quite easily and cause significant pain. Perhaps is kind of hopping around. He wasn't real good on that ankle, but hopefully should be fine for next week. And then Eli Katoa, mate, the thing about this one was it was like the second coming of Bostock from the preseason. He was up in the air. He came down, his leg got caught on someone's shoulder, and he just tweaked that medial knee. So by all accounts, Scott Bailey, the AAP journo, said that he's been cleared as well, Eli Katoa, of any crazy knee injury, and he should be back. Should be fine for next week too. That one is one I just think worth keeping an eye on, because it didn't look great. I went back and watched after he did it, and he looked pretty proppy. So, I mean, there's no major concerns there, but potentially he might need to miss a week. It's one of those things with the Storm. They really don't need to be pushing guys too heavily this early in the season. They can kind of give them a week or two. How are you? I mean, you would have seen the same mechanism I did. What are your thoughts as an owner on Eli Katoa? Like, I think he should be right, but there's a bit of nerves there, I guess.
Yeah, a little bit nervy, I think, Brian. But the only good thing is they have their early game on the Saturday, so they do have a decent turnaround. So you just hope if it's on the minor side, just those extra couple of days might be enough to get him by. I am an owner. I still have David Fafita as well, so I'm sort of moving Fafita on. So if I move Fafita on and had to lose Katoa as well, I'd be struggle street for second rows this week. But that's just the thing with Supercoach. Changes every week, doesn't it? With what you have and what you don't have. We might move on, Brian, to the Warriors versus the Roosters. So RTS had this one with a hamstring injury. That's going to affect a lot of Supercoaches as well, isn't it?
Yeah, mate, I think he's pretty popular. It didn't look great. He looked pretty restricted by it. He kind of tweaked it or suffered the injury and then got back in the defensive line. And to his credit, saved a try effectively, like made a tackle or save a try. But did he damage it further in staying there? Kind of that mix between brave and silly, that kind of move. So I'm thinking at this stage probably going to be at least a month, especially with his history. He had a niggle in the preseason that the Warriors never said what it was. So, potentially that could have been a hamstring niggle, hamstring tightness. And now is that a reoccurrence? If it is, it'd be at least a month. So yeah, I just think he's a sell. I don't think he was performing well enough before that to stay on him, even if it comes out it's minor and he's back in like 2 to 3 weeks. I think there's, the likes of Tui Pilotu, those kind of guys at that price range where you'd be way better off. What are your thoughts?
So many centre wing options, Brian, isn't there? I think you just want to be getting as many of them in your 17 as you can because you can take the punt there. If the low score drops out, I think you just got to load centre wing as you do each and every year, would be my takeaway from that. Broncos Cows was the next one, Brian. So nothing really out of that game. Probably just a little watch on Robert Darby. Looked really good, Brian. I was shocked that he wasn't able to force his way into the team prior to Braden Burns getting injured, but I thought he was, really willing out of the backfield. So shout out to Robert Darby. He's going to be a watch for Supercoach purposes at basement price, when he ticks along there. But he was better than advertised, I thought. So yeah, interesting one to watch there at a centre wing
34
position.
all in base too, I think.
Yeah, I just recall just like carry after carry, and I was like, fire, Rob Derby's like rolling up the sleeves here. He was pretty good for the
He
Cows
had
the other night. I think
28 points in runs. That's
yeah. In a game where it was a bit of an arm wrestle as well. Like, not a lot of guys were standing up to carry the ball out of the backfield. He was one of the few that did that a lot. Like, when you compare his efforts to, say, a Selwyn Cobbo or Jesse Arthur's, like, he was out doing the Broncos boys at the back there, just didn't get the opportunity attack-wise. So, next game, Brian, we don't have any injuries there, is Sharks v Bunnies. Nicho Hynes was talked about pre-game with a cork injury with his quad. He ended up lining up and absolutely braining it. So shout out to Nicho Hynes, one of their favourites on the Magic Sponge. Then Braden Hamlin Uele had I think this is an MCL injury, has been reported in the media, Brian, and Siosifa Talakai with a high ankle sprain as well. So a couple of guys that probably don't have too much fantasy relevance there. And the Sharkies are pretty deep, so they'll probably just play a lot of their bench rotation for slightly bigger mints, I'd assume.
Yeah, I think Uele is probably the most concerning one. Like, not that Talakai's isn't, like, he's had a past syndesmosis injury. It just didn't look like a high force mechanism with Talakai. They can be not high force and still need surgery, mind you. But with Uele, there was a fair bit of force coming down on that knee. MCL, I was kind of relieved that they didn't mention ACL, so I'm hoping he can avoid that. It is a chance with those kind of injuries. So, I mean, we'll wait and see what the scans come back with, but I'm suspecting at least 3 to 4 weeks for Uele, best case. Talakai with the ankle, I think the big thing I want to say here, which is the thing I always say, people blew up Deluxe about me putting hip drop mechanism in the post. Like, once again, it just is a hip drop, especially when you look at it like that. It's like high tackles, right? Like, not all high tackles are these dirty, horrible tackles. Just like not all hip drop tackles are those nasty ones where there's a guy standing still and a guy jumps down on their legs. there can be very tame hip drop tackles too. And this was a tame hip drop tackle. It still was a hip drop because he dropped his hips onto, as he got dragged along, he lost his feet a little bit and dropped his hips. So it is one of those. The main concern there is syndesmosis injury. And then, yeah, I included Nicho, mate, because there was a lot, heaps of messages I got this week about the cork. Once again, tried to over in the broadcast channel on Instagram. We're having a lot of fun over there with keeping up with injuries and any under the table news that I get, sharing it in there, and kind of try to allay everyone's fears in there that, look, the cork, not too much to be worried about. And then, yeah, just shout out to the boys, mate, the Magic Sponge boys, because we're on Nicho at 2. You're on Nicho at 1, even at, if you like Northies, get on Nicho at 1, pick one for draft. We're crowing early in the season. Nicho could go out next week and have a season-ending injury, but I just think it's good to see that injury analysis sometimes works, mate. I think that there was a big part of why he did so poorly at the back end of last year was injury related. I think we can see that now. It's clear that Braden Trindle is more involved, in the game plan and stuff like that. So there's that Braden Trindle factor. But Nicho can still score really well. So I think he just overall is healthier, performing better than he was late last year because of that lingering calf and the ankle injury. So, up the boys. Well done. We get heaps wrong, so we may as well have a bit of a – yeah.
Well, yeah, crow it up. And geez, what I would have given for an earlier draft pick this year. I got late picks in every single draft I was in, and I would have frothed having a bit of Nicho on my team, but not to be this year. It'll be on my radar back again next year, I'm sure. Finns versus Tigers was next, Brian. 2 Tigers out of this one. Jeral Skelton with I think it looks like a hamstring concern, and Samuela Fainu with an ankle injury there. They're 2 guys I've got a lot of exposure to in draft, unfortunately for me. Jeral Skelton's looking like moderate to severe on the hamstring side of things. He was pretty limited functionally with that, so that's not a good sign initially on the field, is it?
Yeah, mate, I think it was a bit of mixed reporting. Obviously, initially came out as a knee injury was what they were suspecting, but then he felt his hammy. Unfortunately, the mechanism video is one of those ones where they put it in the bottom corner. You know how they have the play going on the main screen, and they put the thing down the bottom corner. So it wasn't, and it was a zoomed out view. It's just no good. So you can't even really tell if anything was happening at the knee or not, which I know nobody else cares about, but it's kind of what I like looking at. So, I think the big thing is if it is a hamstring injury here, he was quite limited in his function. I'm always worried about a moderate strain there and a month out. I just think, once again, he's another one where, mid-price, a bit like your RTS, I just don't know whether you could hold on to him if he's going to miss even 2 weeks, for example, because there's just so many good options there. Samuela Fainu with the ankle, it just looked like a little tweak at the end was the only mechanism video I could find. So just a little roll. So I assume that should be right for next week. But I will throw to you as a Skelton owner, a bit similar to the RTS thing. Are you thinking sell at this point, even if it is minor, or are you happy to hold him?
I'm really torn on this one, Brian, because I've just been so high on him all season, and I really do think he should be someone that you have in your team at the end of the year. I sort of look at him as when you think about the center wing landscape, I'm like, well, who are the sort of 4 or 5 or 6 guys you want to have in there? I struggle to go without him. So I don't know whether, if the reports are sort of 4 weeks and over, I still think you need to sell. I think you need to swing for the fences if you got 4 weeks worth of, chances you can take there. But I think anything less than 4, I'm holding, because there's so many other options in centre wing that I've got at the moment. Even the cheaper guys are going okay. So I think I might just try to put out some fires elsewhere in my team, because that's the thing, is everyone's got a lot of fires, I'm sure, to put out. So maybe not Skelton this week. I might just kick the can to next week and see how we go there. But the one that I think I can do with him this week is I can go him to Payne Haas because of the money I've got and the jewels I've got. So that's kind of a no-brainer if I can do it that way. It's, I've got someone who's playing for those 4 weeks. He's at a mid-range. I don't have to move on anyone else that's more highly priced there. So that'd be what I'm doing there, Brian. Your thoughts on other people to move to from Skelton at the mid-range?
Yeah, the guys I'm looking at
Howarth is sort of the smoky.
Yep, and Tui Piloto is my big one. He's just got such a negative break even. The drags just keep going left.
His feed left edge, hey, jeez.
Yeah, so he's
someone
my
you've gotta-
big. I'm zoning in on him this week. If I go anywhere in the CTW, that's where I'm looking. That's for sure.
Yeah, take the dice and start doing the dollar bill signs around the place. That's
How
epic
about
as
them?
well.
How about them banning that? Do you see that?
Yes, let's talk about that. That's funny.
Oh,
Really funny.
mate,
That's really funny. It's good G up.
Flano.
And everyone's like, I hate it. I'm
Oh.
telling you not to do it. I'm like, oh man,
Yeah,
get
but
out of here.
Flano's banned him. Flano's
Yeah,
banned him. Like, what are you?
it's a G
Oh,
up.
come on,
Yeah. Mate, if it
come
was
on.
peptides, it'd be a different story, wouldn't it, Brian?
Yeah,
Just
that's
between you and me
yeah.
and the listeners. Like it was just unsanctioned unsanctioned things getting injected into someone. All good. But no, just doing a dollar bill sign. No, don't play that on. Sorry, we went way off track there into the conspiracy rabbit hole. But we'll loop it back to Titans v Knights. So out of this one, we've got some really interesting injuries here to talk about. So Carter Gordon, actually, no, we'll talk about AJ Brimson first because he's been just reported as cramping. So he's someone that we probably don't need to spend much time on. Dill Lucas has been reported as a moderate grade hamstring injury. Then Carter Gordon is one that's super interesting because he's been diagnosed with a CSF, which is like a cerebrospinal fluid leak. That has pretty big medical implications there. So he's one that we can talk about in a lot more depth. But AJ Brumo, Brian, I guess cramping, we're not worried about that, are we? Just play on for next week.
No, mate, I just got heaps of questions about him. I think he is relatively highly owned. So I
Yeah.
think got quite a few questions. He was just cramping. You could see he was cramping and needed to come off 5 minutes ago. So I don't think they had the game well in hand. So I don't think there's anything too crazy there. Dylan Lucas with the hamstring 6 weeks. There was a bit of, rumors floating around that it was minor and people looking to hold. Unfortunately, classic Newcastle don't give anything away until post game. And this is another one of those ones for me where I'm like, Dylan Lucas doesn't care if that news gets out, obviously, because the news is out now. It doesn't make any difference for competitive advantage. Like, that's not giving the Knights any. Everyone knew Dylan Lucas was out. That was and they obviously knew. They would have known either the day of or the next day, how long he was going to be out for. And I just think holding that information back, it just like the upside doesn't make any sense to me because there are so many people who are so interested in that. And I'm not saying you need to design the game for SuperCoach or for betting or whatever, but part of the game is you need to design the game for people's involvement, like people logging onto websites, watching videos, whatever it may be. If the Knights had put a video out or something the next day running through their injured guys, I'm sure it would have been one of their more watched videos for the year, for example. And I know it's weird to say that in the reflection of a guy suffered an injury, so who cares about a video? But it's just part of the game. It is. So yeah, it just sucks that for everybody who owns him. I'm thankfully not an owner, but if you do own him, my condolences because it's tough now. Because I think I'll throw to you before we talk about the physio nerd stuff with the CSF league with Carter Gordon, but Dylan Lucas definitely a sell, right?
Yeah, 100%. I was just going to say we need a Gus Gould at every club. That's all we need. We need like that sort of inside information, or not inside information. We just need that level of information that Gus really provides to Bulldogs, and I'm sure Bulldogs fans froth it. I froth it as a non-Bulldogs fan. I think it's great. I think it's awesome to hear that and people be upfront in what's sort of going on there. It's really helpful. Yeah, I definitely would sell, especially at his price point. And look at him. I think he's someone that you do want in your end of season teams, but you can't hold him for 6 weeks. Plus this bye this week as well. There's just a lot of other things you can do with that money. Obviously, it's center wing, or if you can go second row or front row with the duels there, there's heaps of options for Dylan Lucas there. So, yeah, he's good for that duel, isn't he? I think that's where he's so appealing for later on in the year. So he'll be one that I look at seriously by the time he gets back. Hopefully, he's around that round 10 sort of mark if 6 week time frame's the one.
Yeah, perfect for the buys. I don't know. I haven't looked into how the Knights look for the buys in terms of their coverage, but he'd just be ideal. Sneak him in there. Hopefully, his buy coverage is not too bad. Yeah, he'd be awesome. Mate, Carter Gordon, the spinal fluid leak. Like, first of all, shout out to Carter Gordon. I'm sure he's a regular listener of the Sponge, obviously, especially with our love of rugby union. I'm sure Carter was listening years ago, back when he was playing for the Wallabies. But mates, like, shout out to him because this is no joke. Like, he got to a point with it where he had to have 2 weeks complete bed rest. And so complete bed rest, when I say complete, it probably wasn't quite complete because he wasn't, bed panning it to pass bladder and bowel. So he was allowed to hop up to use the toilet, but that was it. So otherwise he was flat on his back, lying there for 2 weeks straight. Full on. And it gets to this way with spinal fluid leaks. So effectively, to explain to people what happens is you have your spinal cord, you have your brain, around it sits cerebrospinal fluid. So it's like a fluid that is really rich in nutrients. It's also provides some cushion. So fluid, provides some cushion for the brain and the spinal cord from injury, those kind of things. So if there is injury, and people have asked, like, how could this have happened? He took a pretty regulation hit up and apparently felt something go in his back, and then obviously developed symptoms from there. So the main causes of it is trauma. So head or spine injuries, penetrating injuries, so like getting stabbed either with a knife or a needle or something like that. Whiplash is another one. So the only patient that I've ever seen with it came to me, thankfully, having already been diagnosed, because it's such a tough one to diagnose as well. But she'd had a significant whiplash injury, and effectively it can cause a tear in like the casing that holds that fluid in. You can have like medical procedures. So once again, if there's an injection in and around your spine, that can sometimes have some problems. And then connective tissue disorders like Marfan or Ehlers-Danlos, I've heard of patients with that as well. In terms of like recovery, mate, how long's a piece of string? Like this is one where you throw all you just could not predict it. I think the report in the Courier was like months, and all he's doing at the moment is just riding on an exercise bike. That's about it. He's hoping to get back to training soon, but it's just one of those things. Effectively, that the main symptoms are like headache and those kind of things. He obviously got a back, so obviously the tear for him is in his back somewhere. It's just rest and then just gradually building up your activity and seeing how your body responds to it. See if that spinal fluid is being contained a little bit more, providing the nutrients and the protection that you need to run, to play footy, whatever it may be. So how long is a piece of string? It could be the entire season. It could be 6 weeks. We really don't know. Talking off air, I think you've got a couple of interesting anecdotes about CSF leaks that you've seen, which are pretty cool.
I've got two, Brian. I've got one that was a patient I looked after directly. So she was fairly young. She was in her late 20s. She had a microdiscectomy at one of her lower lumbar levels, and she had a CSF leak after that. So she had, infection and CSF leak. So they had to do, what was the procedure called? I think it was called like a blood patch is what they call it.
Yeah,
where
Gordon had the same thing,
Yeah, so where you take like your own blood and they inject it into the epidural space, and allegedly that's meant to stop where the CSF can leak out of. So it's a pretty extreme procedure, but it's shown to have pretty good success rates, is my understanding with it. And I think this person that I can remember looking after, I think she had a lot of other sort of complex sort of medical things going on there as well. In sort of like multiple pain sites and mental health and migraines on top of that and stuff like that. So she was pretty complex, but I think from like the blood patch point of view, I think she recovered reasonably well from that. There was one other thing I can remember who was a British rugby union player, played in centre or out centre. I can't quite remember who their name was, but they had a big head trauma injury on the footy field, and they were getting treated by the trainer, and the trainer was like, "Well, how are you feeling?" Like, he had like a head cart, and they were sort of just, maybe patching him up, and he sort of said, "Oh, there's no obvious deformity in your skull. Like, how are you feeling?" Like doing all the on-field tests, and he said, "Oh, I've got this really metallic-y, salty taste in my mouth." And the trainer went, "Oh shit! Like, we need to get you off stat because that could be a CSF leak." So when he was doing that interview, he said, "Yeah, that was me having a CSF leak from, fractures in my skull and probably my sinuses in my face. It was leaking cerebrospinal fluid to the back of my throat so I could taste it." And that's a really good one for, clinicians, physio-wise. We're talking to the nerds here that listen along, that if you see someone is primary contact or secondary contact and they've had, significant trauma injuries, well, one we see the most would be really elderly people with a mechanical fall, where they might fracture their neck, and they sort of report this metallic-y taste or this, really salty taste in the back of their mouth following that event. That's a massive, massive, massive red flag that there might be, fracture for one and more stuff going on there. I can think of a couple other people on like inpatient orthopedics wards that I've seen with upper cervical spine fractures that have reported that, metallic-y taste at the time, which got them through emergency and got them to imaging. And I think a lot of them are managed non-operatively as such, but it's a pretty hectic thing. So if you are in primary contact or even secondary contact, wherever you're seeing people, if someone does say, I've got this really metallic taste after a traumatic event, you have to be really, really, really aware to refer on and stay in your lane, Brien, from a physio point of view. Hey, that's the one. Any other sort of anecdotes you got from the CSF point of view, mate? I think we've covered a bit of ground there, haven't we? It's a pretty complicated one. So fingers crossed for Carter Gordon. I was really excited to see what he got offer there for the Titans this year, coming across from Rara, but we'll have to sit and wait there for a bit longer there. Eels vs Bulldogs was next, Brien. No injuries out of that one we need to talk about. So we're going to go to Manly v Raiders. Tommy Turbo was ruled out pre-game with that hamstring tightness, was what's been reported. Steve said this week he's a certain starter for the next round, which is Para at Manly. And the other ones out of this one was Zac Hosking with a hand fracture. He was ruled out pre-game as well, actually. And then Taniela Paseka with an Achilles rupture. Jason Saab's been reported as a lower limb injury as well. There might have been a few people that took the punt on his significant negative break even this week, but maybe not too much to speak there with Jason Staub to start off with, Brien.
Yeah, mate. Once again, this is just going off a video. He came off early and he did seem to be struggling with something. Now, this early in the season, late in the game, was it just cramping? There was no footage of him stretching a cramp, so I wonder whether he's got, and I haven't listened to the post-match presser, so I might be waffling out of my butt right now, but potentially like a hammy, niggle or something, like a calf, some sort of lower limb, groin kind of thing. He just looked to be struggling with something. So hopefully just cramps, but worth watching out for. Paseka, just huge blow with the Achilles. I think, but like my first glance, I was hoping it was calf somehow, just because it wasn't that. He didn't go down like a sack of spuds. We saw with the likes of Alex Johnston is probably the most recent one where he went to push off and just went bang and went straight down. Whereas at least with Paseka, he kind of accelerated through to contact. So I was kind of hoping potentially he could have avoided it. But as soon as the report comes out Achilles, you can just, it's as good as a guarantee because that hands-on testing is so accurate. Zac Hosking with the hand fracture. I think the big one here is a lot of people have asked, why is Zac Hosking 4 to 6 weeks and why is Jahrome Hughes only 2 weeks? There's lots of bones in the hand. They're like, you have some bones that have better blood supply than others. Some are more important for the function of the hand than others. So if you fracture a really important bone in the hand, like your scaphoid is one with a low blood supply, it sits at the base of your thumb, so it can be super painful. That can need a little bit more time, whereas your metacarpals, which are kind of like your the base of your fingers or in through your palm, they can, and if it's a finger injury, for example, they can kind of, come back a little bit quicker. So there's a whole bunch of different bones in the hand. They have different functions, different importances. They can also be different types of fracture too. So you can have like a small little crack, or you could have a bone that's blown to pieces, so it's, there's a lot of ways that 2 weeks can become 10 weeks, for example. We sometimes, if there's tendon involvement or ligament involvement or something like that. So, it's not always cut and dried, like same for just because it says hand, there's not just one bone in the hand. You can fracture the same bone and have different recoveries depending on the type of the fracture. So that was the main point I wanted to get across there. And then Tommy Turbo with a hamstring, mate. As you said, Siebes has said, guaranteed starter for next week. I did hold him this week. I'm not feeling fantastic about it. I am planning on, unless he comes out and looks like the second coming of Tom Trbojevic 2020, I'm probably going to sell him at the end of next week, unless I once again have heaps of fires. They've just got like a run coming up where they've got the likes of, I think it's Melbourne, Penrith, the Sharks, all in like a 5-week period. So not that, look, Turbo's fairly matchup proof when he's fully fit and healthy, but I'm just worried about his health at this point in time. Did you sell? Yeah, you did. Yeah. So, like,
Mm.
what me you have sold me as a holder. I haven't looked forward to the matchups for next week yet, but how would you be feeling? It is against the Rabbits, and Nicho's just put up, 115 against them. How would you feel about me captaining Turbo at this point in time? If we get the signs from training are he's all good. At this point, I should say I'm not 100%. I wouldn't take Siebes' word as far as I could throw it in terms of the whole. He's definitely going to start next week. Like Turbo could get hamstring tightness in training this week and then need to sit out. So I'm definitely not counting on him definitely playing. I think there is some doubt. A few guys have messaged me and I said I'm kind of 75-25. 75% he will play, 25% he won't. But let's say he's all fit and healthy, firing, looking good. Should I captain him?
Yeah, 100%. And probably don't need to elaborate on that, do you? Like, it's the ultimate matchup. Like, Para looks so bad. And, Manly just put the blowtorch on most teams, especially those mid to lower ranked
Are they
teams. Like,
Para or Rabbits next week? Sorry. I thought it was
yeah, they
Rabbits.
got Para. Yeah,
Oh,
no,
they
they got
got
Para. I think
Para.
the
Oh, that's
Bunnies
even.
have
Sorry. Yeah. No, that's I take it back. Para's
Yeah,
even better a matchup.
yeah,
Yeah.
even better. It's like the best possible outcome
Yeah.
you could possibly have. The team running 17th away from home. They look like they're going absolutely nowhere far. So yeah, he's the obvious captaincy. Like for me, because I don't own him, I'm probably looking at Papenhuyzen against the Dragons there, and probably VCing one of the Broncos to see if I can hit a score there with them with the Finns versus the Broncos on the Friday night. Is probably the other consideration there, Brian. So that'd be the way I'm sort of shaping up. That's just a wrap of the injuries. Well done, mate. We've done really, really well to get through them. Question time. So thank you to everyone who submitted those questions, primarily through the broadcast channel on Instagram, I think, Brian. So shout out to everyone who got questions on here. Let's launch in, Brian. We've got a few to get through. First one is, how are you feeling about the Rabbitohs guys now that they're all coming back shortly? Would you be happy to jump straight on Latrell Mitchell or Ewan Aiken or Alex Johnson, for example?
Aiken's probably the one for me that I don't mind because I just think the Bunnies need him on an edge and they need him to play big minutes. And I'm not overly stressed. Like I do forwards coming off shoulder injuries. You do expect a little bit of a softening up period. But Aitken, I think I've stashed him in a few draft leagues now that we know he's sort of due back round 6. So I've still got to, get through round 4 and 5 without him, but I like the Ewan Aitken kind of stash, particularly for drafts. I don't think any of them you need to look at for Classic. I think you just wait and watch and sort of see how they go. The guy I'm least confident on is Alex Johnson. Look, I know being the left winger for the Rabbits, kind of only a lot of the time have to be a fall over guy. Like, you get put in space so often, but I'd want him to come back and see a lot of explosiveness. And I just don't think like he has the upside coming off an Achilles that a lot of other guys in the CTW do. So he's not someone I'm chasing. The big money story, mate, Latrell. What do you do there? I've got him in a couple of draft leagues from a classic perspective. Look, the rig looks fantastic. You and I have been, messaging each other about it. We love a rig-based selection. Shout out Selwyn Throbo. Not that that's worked out all that well for us, unfortunately. But I couldn't do it. I couldn't do it from a classic perspective. In terms of straight away, I like my bare minimum is I'd need to see him get through those first 2 weeks. Once again, we see the re-injury risk come down after those first 2 weeks from about 10% to down to about 4%, even lower. Historically, he's just had so many soft tissue injuries. Latrell, he was in the best shape of his life, and he suffered another hammy injury. So yeah, I just especially with Origin. Kind of by the time he comes back, so I think around 5, they were saying, that it gives him enough time to kind of prove his fitness for Origin. So you're not only absorbing injury risk, but then you're absorbing the risk that even if you have him and he plays really, really well, you then lose him for Origin as well. And with this hamstring injury, I just wonder whether the Bunnies are going to be willing to back him up with the loading concerns. He's got a recent hamstring injury. Do we really want to rush him back out there? It's a similar sort of thought process for a Tommy Turbo as well. Now, look, mate, as much as I love Latrell, I know you froth Latrell. So, like, how are you feeling? Like, when he's named, if they've got a good matchup, say from round 5, are you happy to pull the trigger on him first game back?
Yeah, I want a piece of it massively. I really do. And the thing that mitigates all my negative thoughts is just Wayne Bennett standing there, arms folded, with the sunglasses on and his Rabbitohs hat. And I'm just like, that instills an enormous sense of safety that is difficult to quantify. And I think when you throw in, you got the godfather of coaching of rugby league who routinely gets the best out of these boys. You got the Latrell rig looking as good as it's looked for how long, Brian? Let's say 5 years, maybe
Since the
6.
Roosters,
I would
maybe,
say
I
probably
reckon.
since the
Yeah.
Roosters. So we're talking 2019 grand final maybe when he's dusting someone off and setting up their try at the death there. It's hard not to say no. Roosters, Cowboys, Bulldogs, Storm, Knights, Broncos, West Tigers before the bye and Origin period. It's not the best draw to be fair, but I think Latrell's as close to matchup proof as there has been in the competition, isn't there? And if he's just in the mood and the Bunnies are, not having too many guys on the sideline there, I don't think it's a bad call at all. They're talking about him goal kicking as well straight out of the gate too. So I don't think there's any concern about Humphreys kicking it further. That would be the only thing is I would take the argument of maybe just see who kicks the goals against the Roosters and then bring him in round 6 against the Cowboys and just ride him through those periods. So I think he could be absolutely mega. He is pricey though. That's the only thing about Latrell is if you just get a bit of a discount, you'd be better for it. But yeah, he's just box office, Brian. I just love watching him and what he's about. And just think about Wayne Bennett. If you're on the fence about it, just think, Uncle Wayne will get him firing. Don't worry about it. So just trust Wayne. We said it last year with the Finns. Just trust Wayne, and good things will come your way.
Mate,
Question number.
can I just jump in? I think your ideal scenario, and what I'm trying to do the math in my head. If you go Paps this week, you then have the let's say 4 weeks of Paps goal kicking with Meaney out
Now we're talking.
into
Yep.
Latrell. That's my
Yep.
that in my head. I was like, that's kind of what I was thinking could be. Yeah, if I see enough from Latrell, because you'll have about 2 or 3 weeks of crossover, and hopefully Paps with his negative break even goal kicking scores enough that once again the prices aren't that different. That's kind of where I'm at the moment.
Yeah, that's hot as fuck thinking about that, Brian. Let's be honest. That's getting me all bothered in here. Second question is, do all head injuries fall all under the HIA protocol? So Viliami Vailea, for example, came off after he got sort of poked in the eye in that sort of Cowboys-Broncos game, and it looked like they used the HIA card to get a free interchange for him. So do they all fall under the HIA protocol?
Yeah, sorry, I forgot to include Vailea in the run sheet too, but he's all good. I put a post out today, just a scratch, so nothing to do with the structure of the eye or anything like that, which is good, which is concerning for these kind of ones. Look, in terms of the poke in the eye counting as a HIA, it's a real grey area because the medical staff from the Cowboys or from any club are gonna have an argument that look, he's copped a blow in and around the head and he's got blurred vision. Right now, you could argue, we saw it was a poke in the eye, like on the telecast or whatever it may be. But once again, he's copped a blow in and around his head and he's got blurred vision, or he might have dizziness or double vision. That could be a concussion symptom. We don't know for sure. So it's one of those things where it's a grey area. They do get it, and they're going to get it every time. Every time they're going to get it because there's just no way to definitively say, because it'd only take one to miss where they miss it and then there's a problem, it'd be big trouble. So yeah, they do kind of, anytime there's a blow in around the head, and it doesn't even have to be a blow in around the head, it can be whiplash, it can be all those kind of things. The HIA, look, we've said it for years and years. We can't wait for the objective tests to come out, those things that are going to allow us to not base it on, interpretation and symptoms. It's going to be a saliva test or a blood test or whatever it may be. They're coming soon, hopefully. But for the moment, it's subjective. And while it is, pokes in the eye are going to count as HIAs. As free interchanges.
Yeah, well summarised. The question following that is in the similar vein, but how do players get an exemption from the 11-day stand-down period if they have suffered a concussion?
Yeah, I hate having to even talk about this because it's just like, why have an 11-day stand-down if you can kind of have some ways to get around it. Does not make much sense to me. But the criteria, I've got it listed here. So you can't show category 1 signs or symptoms. So in other words, the category 1 are your ones that, like, he's clearly knocked out, he's clearly stumbled. Those kind of things. If you're able to clearly observe that category 1, or you hear a guy category 1, they cannot get an exemption. Although I will say that like your Tom Turbo and I think it was Connolly Lemuelu are probably the 2 big ones. Victor Radley might have done it as well. They were deemed category 1 by the independent doctor and then challenged that there was no symptoms at all. It was something complete, and all 3 of those guys have got off. So this is the thing where even if it's category 1, sometimes teams can get around it. So it's just an absolute dog's breakfast. As I said, I just cannot believe that it's so. Yeah, but it's hard for me to understand sometimes. So I can't imagine what fans are like as well, which is really tough. The player needs to be asymptomatic the day following the concussion. So it means they need to be symptom-free. They can't still have symptoms. So even if they have category 2 symptoms the night of, and they're hoping to apply for an exemption, if they have headaches the next day, gone. Their cognitive testing has to have returned to normal, which is an obvious. The player has to have suffered fewer than 5 previous career concussions. So someone like Radley, for example, even if he has a category 2 HIA and then fails that HIA, he cannot challenge the 11 days because he's had more than 5. The player cannot have previously diagnosed concussions within the previous 3 months. So we had someone like Ruben Garrick last year. He had 2 or 3 concussions, so he just would have not been able to because they were all so close together. And then the player can't have a history of previous concussion with prolonged recovery. So who have we got? Alex Twal, for example, someone like Will Warbrick. So Will Warbrick now won't be able to challenge, won't be able to apply for an exemption because he has a concussion with prolonged recovery. It's taken longer than the 11 days. He's got lingering symptoms. So yeah, they're the main criteria if you're looking out. But look, the big thing I would say here is I do not blame you for being like, what the heck is going on? Because yeah, it is not clear in the slightest.
Yeah, it's a classic case of rugby league, like not only shooting themselves in the foot, but like shooting the other foot and the side of your knee and your hip on the way back up into your pocket. It's just one of those things that just gets made way too complicated. Next question we've got, Brian, is about some Panthers boys, about Dylan Edwards, how he's tracking, and whether Nathan Cleary passed his HIA.
Yeah, so by all accounts, Dylan's doing well. I think he's already started some on-field work was the report. So, still tracking for that. I think missing 2 to 3 weeks. And, yeah, not that the Panthers necessarily have to rush him back, but I think they will want him back ASAP, especially going down 2 games already. Cleary passed his HIA. They didn't say whether he did the head injury assessment. Ivan did say that it was that Nathan remembered the incident. So obviously, not that means a whole lot, but it's one sliver of positive. But yeah, just a classic. We're going to have to wait and see with Cleary, unfortunately.
Next question, Brian's an interesting one. Is about the long-term impacts that footy might have on NRL players' bodies long-term. Because we know, I guess, there's a bit of CTE risk and that's sort of emerging as the literature gets published. But what are the other long-term issues that come up for ex-players or former players?
Yeah, mate, I think this is probably something that both you and I see quite a bit of, and it's not just NRL players, but, park footy players as well who abuse their bodies. The big ones, OA, osteoarthritis, big, playing through stuff that normal, everyday people just wouldn't play through. And that, comes with wear and tear on the joint and joint surfaces, particularly have surgery. So a lot of NRL players will have a shoulder reconstruction in their career. So anytime you're having, shoulder surgery, that increases your risk of cartilage degeneration, OA down the track. So you hear lots of stories that NRL players have an early joint replacement surgeries. I think Sterlo had both his knees done, in recent times, or not even in recent times, talking going back like 10 to 20 years or something like that. So that's probably the biggest one. You get a lot of guys who will have different things come up because of like repeat painkiller use, injections, those kind of things, like scar tissue build up, these kind of things. But yeah, I would say the main one is just that joint degeneration. You see quite a bit of it in post career kind of stuff. What have you got for me, mate? Anything to add to that?
No with the add-ons, I don't think, Brian. I think there's a little bit of crossover with those guys from a couple of gens back, where there's probably a few lifestyle factors that you can't sort of fully say with 100% conviction, I guess, for people playing along, that, just because of the amount of activity that is responsible for their joints, like there's a lot of other lifestyle factors that do factor into that as well. And I guess, the smokes and the booze was a big one way back when, and I can think of a few ex-players. I haven't seen too many in my sort of clinical work, Brian, I've got to say, but I can think of a few that have played, long periods of time, even, club footy and park footy and stuff like that. And yeah, the post-traumatic sort of arthritic change that they have following surgeries is pretty big, especially with, even knee scopes and stuff like that. You do see an element of that with players post-career. Next question, Brian, we'll move on, is any updates on Tino's calf? It looks like he had a bit of ice on it and a bit of a limp after the game. I didn't notice that. Was there anything that you saw with your eagle eye?
No, I went back and had a look. He looked pretty good, even up to when he left the field. I think he left the field in the 60th minute and he played 55 minutes and they were up a bazillion points. So this might be my Tino by the year, rose-colored tinted glasses on. But yeah, I don't think there was too much there. A bit like the Nicho story, like he had ice on his knee after the game last week, had a knee sleeve, didn't do training earlier in the week. Like, yeah, the one thing is these guys deal with that kind of stuff all the time, different corks, bumps, bruises, those kind of things. So he could have had a calf cork, for example. They just needed a bit of ice on him because the ice was strapped really heavily to his calf. He could have had a bit of a limp as well. So, yeah, I mean, we'll wait and see on that one, but I think there's a lot of things like that. And yeah, shout out Tino, mate. Oh man, I don't know what he got updated to actually,
Yeah,
but
I don't know. He was sitting at 61 or thereabouts, wasn't he?
yeah,
In
he
that
was
sort of length of
61.
time.
I don't know if they've updated it at the
Fully updated
moment.
that, to be honest.
But
Yeah, I think
yeah, no, still yet to update, but he should get a few
get a couple
with
more.
offloads and stuff. So yeah,
Yeah.
mate, just what a man. Gimpy. Love it.
Yeah, from the 4570, Brian, from God's country for those ones from Gimpy. Next question, player related, Brian, is about Connor Watson. Is there any fears for his beautiful face beyond his concussion sustained this week, Brian?
Shout
That's a good
out
question.
to
I like that.
the SC Baller boys. They sent this one in. No concerns for his beautiful face. There was no reports of fractures or anything like that. So you just have to wait for the week out, and then he'll be back doing his thing. He was doing well before he got the concussion. So I think
He was going good.
yeah.
Yeah, like that. Next one's about Taniela Paseka, Brian. We talked about him tearing his Achilles and needing surgery on that, but we've spoken on the podcast about a lot of Achilles having non-surgical treatment. So I guess the question is, why is he having surgery when Achilles was moving towards non-surgical management? I guess probably is sort of a different sort of, I guess, population group is probably the best way to explain it, isn't it, Brian, between Taniela Paseka and some of the people that I certainly say I would see, for example.
Yeah, just different demands, mate. Like I had a lady, she came in 35 last week, and she's opted to go non-surgical with Achilles, but she was just playing, social netball, having fun, and so I think the biggest thing is the demands on the Achilles and on that explosiveness that the Achilles provides is the big difference here, in that non-surgical treatment for everyday people is a fantastic option because there's really good, mid to long-term success rates. Your function is relatively good. You can still play like social sport, all those kind of things. But it's the power that you don't gain back. And I think you've got more on the specific percentage, but there's a percentage. I haven't checked my specific research papers in recent times, but there's a certain percentage of power and explosiveness that Achilles doesn't get back with non-surgical treatment. And for everyday people, that's not that big a deal. But for an elite athlete like Taniela Paseka, it is a big deal. So it differs from you hear us bang on all the time about ACLs, potentially who's going to be the first one to, go down the ACL non-surgical path, there doesn't seem to be much evidence that in those that are successful with that process, they can perform just as well. Whereas here, if you go non-surgical, it's very unlikely that you're going to get that explosiveness and that power back. So that's probably the main one. I think you're my evidence guy, mate. What evidence you got for me?
Oh, this is delving into the file cabinet of my brain, Brian, which is very, very unreliable. But my understanding was it was about a year down the track, I think, when they measure relative strength in the calf and Achilles unit, I suppose it was an 18% difference in operative versus non-operative management, generally speaking. So again, for the average person who's not an elite athlete who loses 18% of their high-end speed or power, probably doesn't translate to too many issues day to day. You can get by with that amount if you're doing, those sort of activities versus Taniela Paseka, who, needs to have that extra for his, career. That's not a long career either, Brian. You do have to have these guys performing at very, very high levels for as long as you can for their careers, I guess, is the best way to sum that up. We'll move on from Paseka to Victor Radley. What are we talking about with his concussion history here, Brian? The question is about whether he should be considering retirement due to repeat concussions. What are your thoughts on that?
Yeah, we get a lot of catastrophizing with concussions in terms of going to worst case scenario. I'm never, going to say that talking about concerns around concussion is unwarranted, but to go straight to, should you retire, especially from the outside looking in, is always, you're fraught with danger there. He's had 6, but there's guys like Tedesco who've had more and are still playing in the game. Each concussion case is very individual. Some players can have 1 concussion, need to retire. Others can have 10 and not need to. It's at the end of the day, it's about his brain function, which we'll probably never have the answers to. He's not going to release those testing results, but that's probably the biggest thing is how's his brain function now compared to 3 years ago, 5 years ago, all those kind of things. The biggest thing I think he needs to do is go away and work on his tackle technique. I know he's talked about it in the past. It just seems to be getting him in the wrong positions, whether it's high or low, because he's had plenty of concussions up high and he's had plenty down low as well. So I think, it's one of those things where guys like Radley go in so hard, and when it comes off, it is so good, right? Radley is known for those big moment changes or, the game changing moments where he puts on a hit, boys get around him, love and life. But I think the downside to that obviously is if you go in really hard, sometimes you come off second best. So that would be my thing, is more tackle technique as opposed to retirement at this point in time.
Good summary, Brian. So next question is an interesting one. It's about Corey Harawira he was at the Raiders there when all this stuff went down from a medical perspective. I think he's still listed on the casualty ward as just indefinite, I believe. Have you heard any updates about Corey Harawira?
Yeah, the last update was, I think, in the off season where no doctors were kind of willing to to clear him to play because he had to have that implant in there to help with his heart rhythm. So look, no updates beyond that. Unfortunately, I have heard that he's still on the Raiders, still in and around the Raiders club and stuff like that. So it's great that they're looking after him. But no further updates beyond yet. Doesn't sound like there's going to be anyone who will clear him to play. Unfortunately, sounds like a bit like the Carl Oluwapu situation,
Yeah, good call. Yeah, it's a tricky one, isn't it? So a lot of complexity in those sort of decisions. Second last question, Brian. This is a quick one. Jaden Campbell or Lockie Galvin at 5'8"? Who would you choose?
Jaden for me, mate. I'll throw straight back to you, Supercoach. What do you got?
Jaden as well. Love the ceiling there with Jaden, and love that he runs at deluxe and kicks goals. We're going to talk about him in SuperCoach Corner as well, but it would be Jaden Campbell for me. Last one. This is a good question. Was letting Valence Tafare leave the start of the death knell of the Dolphins as a rugby league club and entity?
Matty McPhee, who
Brian?
asked this question, he's a big Finns fan. He's commonly messaging me, just lamenting the Finns. I think his latest
We
one
need a
was
Val. We need a Val in here, but Val short. That's
what
very
is
true.
happening. We need some middles, and Val could play anywhere, mate. Look, there's a lot of talk about the Wayne Bennett curse. I've said it. It's not a Wayne Bennett curse, mate. It's the Val Tafare curse. Don't let the best player in your team go, or just yeah, I'm sure Japanese rugby, the Shizuoka Blue Revs, my local side, are just loving having him around. Look, let's get straight into it. SuperCoach Corner. James, mate, it was an absolutely brutal week across, with Cleary going down, Connor Watson, Skelton, these kind of guys. How did you go? And what are your trade plans moving forward?
Well, I went not great, which is nothing new for this time of the week when we talk about this on Sunday night, Brian. So 10-69 was the score. VC Nicho. I remember messaging you straight off the game and being like, I just don't feel like I can hit the loop on this. And I saw Ponga, and I stuck with the captain on him like the other 40% of super coaches that did as well. And I sort of had a bit of bias right there. Anyway, it was what it was. The week just gone. So I went Turbo out, Duffy out, Purdue out, brought in Tamale, Arthurs, and Starling. So I'm very, very anxious, like I said earlier, about Manly versus Para this week because Turbo could score 400.
Have you still got Garrick?
Terrifies me. Yeah.
Yeah, okay. Yeah, cool.
So I feel better about that because my option was this week just gone to do Turbo or Garrick.
Yeah.
So I chose correctly there. So for now, Turbo might just go bigger next week and Garrick might sort of follow him up as well. Who knows? It could be bad. So I've got 626 grand in the kitty. So this week I need to move 3 out of either Dave Fafita, Jeral Skelton, Selwyn Cobbo, Jack Goz, Matt Burton are the ones on the chopping block. If Eli Katoa is out, then I might be in a bit of trouble at second row. So I guess question before I launch into the rest of my rant here, Brian, am I off my head to keep Dave Fafita if he's named to start, or should I just delete the app for 2025 and start again next year? What should I do?
Mate, you've got 626 in the kitty. Like, I don't mind it. I think cash is the least of your problems at the moment. So, like, I think if Fafita's named to start, I think he's a great point of difference. I think if you were having cash problems, but man, you can do a lot of damage. Like like with 626, you can take Skelton, Cobbo, Matt Burton, to 3 really good players. Just deal with Jack Goz for another week. I'm probably going to have to do the same. Yeah, I don't mind it. I don't mind it with the cash that you've got. Yeah, I mean, everyone's going to want Fafita at some point. If he starts, he could easily pop off 120 and then he doesn't lose that much cash anyway. So yeah, I would much rather hold on to a Dave Fafita over like a Skelton, for example.
Good point, mate. So the plans this week are to get 3 in. So I've got to get Kane Haas in. He was the one I didn't get last week. I can still get him in pretty comfortably this week with money. I didn't expect Payne to put up his best ever Supercoach score, if I'm honest. But what a game and what a player. But anyway, I'll get him in this week and I'll enjoy the ride there as a Broncos fan. The other ones, Papenhuyzen, Tino Fa'asuamaleaui, Jaden Campbell, Cam Munster, Nicholson from the Raiders, or Christian Tuipolotu. So just got to find 3 out of them. They're all pretty good options, Brian. Like, I don't really have too many sort of major, strong inklings either way. I am on point of difference watch, though. So on Pod Watch, these are the guys I'm just keeping tabs on at the moment. So Campbell Graham at 5%, good base, but hasn't had any attacking yet. And with Latrell in the wings, I think that could be really, really, really attractive. Calero is only 2% owned. Marky Mark from the Roosters is 6% owned and looking good. Bo Fermor at 2% is getting absolutely fed on the left side of the Titans attack there, especially with Jaden Campbell getting a lot of ball down that left side. The other one second row is CY Wong. He's at 6% ownership and cheaply priced. It looks like with Radley's injury, he could be a really consistent week in and week out starter there for your team that might just fill a gap or two for a period of time. They all look better than expected to me. So they're guys I've definitely got an eye on. If I'm not going to bring any of them in this week, it will be hopefully soon. I'm massively eyeing off Scotty Drinkwater though, Brian. Like, the cows are yuck. Understand. Like, I know people are probably throwing up in their mouth thinking about the Cowboys attack and their team in general and their team selections, but let's be real. The heat is on Todd Payten here, and if he just figures out how to coach and select an NRL team properly, the goal kicking fullback can still be really valuable for SuperCoach. So I think he's still one that is a bit of a watch. His draw is not the best, though, at the present. I think he's probably more like a round 7 bring in, because if I just get the Cowboys up here now, people will humour me for another second.
I think on my thing I said to you is after the bye, I think is the only time I would consider him, yeah.
Yeah, so he does have a round 7 bye and the Bunnies before round 7. So you could argue round 6 against the Bunnies is a softer matchup, but then he's got the round 7 bye. Then he goes into Titans, Warriors, Panthers, Manly bye in round 12. And then you got the origin period there, which they probably won't be majorly affected by this year, given how badly everyone's going there at the Cowboys. So I really, really like him as a goal-kicking fullback that doesn't have a lot of love at the moment. He's got a high break even this week, though, as well. So he might just plateau in money a little bit there, and he might be someone to bring in. The other one I really just want to give a scorching take here before I sign off of Supercoach's Corner, Brian, but just Jaden Campbell absolutely reeks of Nicho Hynes 2.0 to me. Like, if you had to sort of look at a player who's got a similar trajectory, who made a move from the fullback to the halves, took a while to settle into a position. He's got lots of runs. He's creative. He's a goal kicker in a team that's not shy of scoring in attack. Man, oh man, Jaden Campbell's hard to leave out of your trade plans this week just because of the ceiling that he offers and how much he gets his hands on the ball and how much he runs the ball. I think the Titans are going to be streaky. Just live with it. Like, they're going to be up and down week to week. But I think Jaden Campbell is a really fun watch. But when you're looking at those guys who are going to make the step up to like the 80-point average or the 85-point average, he's probably one of the few outside of the fullbacks that could do it, isn't he? Like, when you think about guys who have that ability, he's probably only one of him, Cleary, and Nicho that, to my thinking, can sort of do that outside the bigger fullbacks. So I think when you look at Jaden Campbell, you think, oh, he's never had Supercoach pedigree. He's never been one I'm being really keen on. He was very streaky last year. I I like leaning into that uncertainty. I think you can just lean into it because you don't want to be the guy at the end of the year who goes, far out. How did I not see Jaden Campbell coming in 2025? I think he's here now before the prices jump. I think this is probably the week to jump on board and ride that train. He's not going to be origin affected. Seems like he's locked down the 7 position. I can't really see myself going Cameron Munster in for Matt Burton rather than Jaden Campbell. I think Brien, now he's got through that first round bye. I really like what he's about. I don't know. What are your thoughts on Jaden Campbell, mate? I've sort of slept him hard there, but I think there's a pretty good reason to. Drink water as well, but, Jaden Campbell, I think, just absolutely reeks of the next super coach thing.
Yeah, mate, I think you wouldn't find two guys who were higher on Munster than us, I reckon, going into the season. Like we both said, back end of round 1 from a draft perspective, and we're both pretty high on him and for whatever idiotic reason transitioned to Burton at the last minute, both of us. But look, I've got in mind, like, I think you can wait a week on Munster, and I'm potentially bypassing him for Jaden Campbell if he keeps looking good. I just think cash isn't really a major issue for me at this point in time. I've got Dewey floating around where he can drop down, and I can send a Cobbo or something to Jaden Campbell and not cost me that much. So I'm definitely eyeing that off. I love the play. Love Nicho. I think from a drinky perspective, what you were saying there, I'm looking at him round 8 onwards. I just don't think I could carry him through a bye potentially with the way that they're going. And the big shout out, Campbell Graham, mate. He was initially the injury bye of the
Base
year,
is
and
so
then
good, mate. His base is so good, and just nothing's coming
48.
away yet.
48 base over the weekend. I think last week was a little bit down, but yeah, I obviously went off him because once the Latrell and Cam, injuries happened, it was never that I thought that Campbell would not be physically up to it or doing well. It's just that, I thought the Bunnies were cooked, and he wasn't going to get much attacking, which seems to be the case, but Latrell's coming back now. So I love the Campbell Graham over Origin potentially once again is another play that could be. He might actually lose money, which at his cheap price, would be gold. So yeah, don't mind that if the Bunnies start clicking and Latrell brings back, he absolutely kills it. That would be Campbell Graham. I might be back on him as a bit of an injury buy. I got 11.33 for me. I VC'd Haas and took the loop. So I brought in Haas, Tamale, and Arthurs to bring in Tamale in for Jackson Purdue. That was fantastic trade. I've done 2 trades now where I've gone cheapy to cheapy. I brought in Jack Goz for Charlie Geimer, and that's just gone fucking horrible as well. So
Jack Goz had an electric try on the weekend, Brian. Didn't you see the regather and score there for a grand total of 35? It was good.
Mate,
Up the Bronx.
up the Bronx, but come on. I need Madge to still be a little bit cooked for the next couple of weeks. I need him to still like Goz, and I need him to still like Shibasaki for a few more weeks just to get me those points.
Shibasaki's not losing that spot, seriously, after the game. We didn't talk about that. He was rock solid. And
Mariner looked a bit...
comparatively, no real impact on the game there. I was shocked. I couldn't believe my eyes. I was nearly went to Specsavers halfway through the game because Shibasaki was going pretty good. I was, pretty taken aback, to be honest, but I don't think he's going to lose his spot anytime soon.
Yeah, no, I'm pretty confident in Shibs, but yeah, the Goz, mate, he's really plugging up a problem in my side. So this week, I really like the look of Nicholson. I am a bit worried that Hosking might come back early, but in saying that, like even with Hosking there last time, Nicholson started. So and now you've got Morgan Smithies, who's had a HIA, so he's going to miss a week. So does that give an opportunity for Nicholson to kind of lock down the spot a little bit more? So he's definitely got someone I've got an eye on. I really want Paps or Gutho this week. I'm thinking it'll be Paps, but Gutho definitely interests me. Like even Gutho's given me, or Paps is giving me feelings of like, do I go Turbo down to them next week after Turbo's thing? But I want 3 gun fullbacks. I think I like Iongi, but I just para, man. So I just think that's 3. The only thing I would say is I could go 2 gun fullbacks and then bring in Jaden Campbell. So that would be my other option, is whether I bypass them. But I like 3 gun fullbacks and then Jaden Campbell at 5'8". I just think that is, if I could have 3 gun fullbacks, Jaden Campbell, and then Cleary and Hynes firing at halfback, I like, that I want to get to that as quickly as possible. That's kind of my aim at the moment. I do have my eye on Tui Pilotu. He's the guy at the CTW. The only other guy to think about is Stafford Toa if you need to free up some cash. And then your likes I mentioned him last week, but I think everyone's gone to Tommy Starling. I don't mind Mamazelos. 2 80-minute games in a row. Just a guy who's going to cost you like $360K, and he could just be your perfect, 80-minute hooker. Hooker 2 that just sits there. So he's someone I'm considering as well, but that's a bit of a boring one, especially to spend a boost on. So I'm thinking more do some exciting things. So we'll see how you go. My big super coach take, which I want to throw to you, is the more I've sort of seen it all go down, and even now seeing sort of how your weekend turned out, because we were talking after Nicho and you said, look, don't think I should, it's not enough to loop. Like, I'm wondering whether 100 is like loopable now, just because the flex, I think this week was probably a little bit different because you had Cleary on 2. So it's like, well, what, like I can't get around that, right? Like I'm going to drop Cleary out. So to bring your auto emergency in. But like, once again, for me, like I ended up starting, what's his name? The Tamale, right? And he would have been like, I selected him as a reserve. He would have been my auto emergency, right? So it didn't end up, if I had have not looped, it just didn't cost me anything. So I just think with the flex dropping out those that your lower score, I've got a feeling that I'm going to be pretty happy to lock in 100 and just be like, because you just see what happened. Because then for someone like Kalen, like, yes, he scores hundreds pretty commonly, but he's still got to do it. And you're only really losing out if he scores a lot more than that this early in the season. Different later in the season when you've got like 4 absolutely gun reserves, right? And so you're dropping a gun reserve for like your scrubber, right? But at the moment, trying to pick reserves is an absolute shit fight.
Yeah,
So
that's really fair.
yeah,
Yeah.
so it's like you're not actually, the chances are you're not going to lose out on much. So my feel at the moment, and I mean, thrown to you, is like, do you think that that's a fair take, that like 100, maybe you just bank it and go, well, I'm probably going to choose a shit last reserve anyway, so why not just bank the 100 while I've got it?
It's a pretty good point, because my plan is to sort of reserve most of the center wings as well. So if you're going to, reserve like Shibasaki, Tamale, and Toya, for example, which is what I did just the week gone, you might as well hit the VC on less, because my sort of threshold was like, 120 historically has always
that
been a
was mine
roundabout
too.
threshold. I know people sort of above or below that, whatever. And it has worked out well. I think earlier in the season when I looped, I think Ponga at sort of price, and Cleary didn't go as big, and I think it's a valid point, Brian, that you make, that maybe you just need to decrease the threshold to 100 and just, bank the double points, because with HIAs as well and the variance in scoring, even Reece Walsh pumped out a 9 the other day. Like you just and honestly, mate, Kalen was lucky to get 45 because he got an absolute garbage try assist at the end, which with 2 minutes or 3 minutes left. Like it could have been a 36-point captain week from Kalen there for all you know. So they're just the ones you just want to avoid at all hell cost. I think it's probably better just to lock it in and hope you drop off one of your scrub reserves and go that way. I like your thinking, to be honest, mate, especially with the week just gone. I was like, I dodged Nathan Cleary, but then when the VC was there and I was like, well, he'll update a little bit more. I think he was at sort of at 104 or something. And we were like, a few offloads, like might be 110. I was like, it's probably just not quite there. I should have just been like, you know what, gets me to 220. Nathan Cleary missed for heaps of people. I should have just locked that in in hindsight there, but I just saw, Titans v Ponga as a matchup where he could have scored a lot of points. But again, Knights are missing just a couple on the road. Bounce back factor for the Titans. It's a close comp. I think it was, and we've only got a couple of weeks of data to go off, so you can't really make this is how good this team is. This is how bad this other team is yet, I don't think.
And to be fair, like this is me being Captain Hindsight because I didn't say any of this to you. It was literally your specific situation that made me think of it. Is like I kind of agreed with you and went, yeah, no, like 100 not enough. But then the more I kind of thought about it over the weekend, I'm like, well, especially Tamale today, where I chose him as my last reserve, and he scored like 18, and I'm like, I flitted between him and Yongi all day, and that's cost me 40 points or something like that. But I'm just like, oh man, like just choosing your last reserve when it's this stage of the season is so hard anyway. So why not just accept it and go, well, I'm just going to bank the scores. And then the other thing I wanted your opinion on, mate, are we back in 2012, 2013 when we first started playing Supercoach, when you just captain Anthony LaFranchi, Craig Fitzgibbon, every week in and week out? Like, do you just captain Payne Haas, mate? Like because it's like he obviously had that try, which took him to ridiculous. But like, seeing some, some of the content creators put out like the stats where like base plus power, which is like, your base is your tackles and your runs, and then your power is your tackle breaks and your offloads. Like he's base plus powering 100 at the moment. So that's just your bare bones. You're not even relying on anything to happen. Mate, I just don't see a week, like even next week, right? Hopefully we're both going to own Paps. So they're going to be against the Dragons. We got Turbo against the Eels. Cleary's, Hynes has probably got another good matchup next week. I don't know who he's playing, but like he's another option. Like there's a lot of guys, but I'm still like, I feel like Payne has to be your VC or your C. That's kind of where I'm at. What do you reckon?
Yeah, he's literally touching Corey Parker. He's touching God at the moment, isn't he? He's in that sort of realm where he's just like, how does this guy score less than 70?
Yeah.
It just doesn't look like he'll ever score less than 70 all season. Like the games in himself, and even that try he scored at the death, he's just got the motor.
Oh.
Everyone else was gassed. And honestly, Ruben Kotick gave him a pat on the backside. Jason Tamalolo was stuck in the mud, and he just ran by Scotty Drinkwater, who was just like, oh, nothing will happen. This will just be a carry. And Payne Haas just freak of nature. Hey, honestly, like what he's been able to do this year for the Broncos. And honestly, Brian, you've got to give Madge credit that he's not just trucking him up the middle and playing him for 70 minutes every week. He's strategic in how he's deploying him. He's obviously giving him an objective to run wide off the ruck as well. Get 2 passes wide, get at a smaller body, and get your hands free, because the Broncos are better when that happens. And I think that's a really, really dangerous prospect for the rest of the comp. It's also why, Jack Goz is completely unappealing for Supercoach, because Payne Haas runs that sort of wider line. And if you're going to choose to throw the ball to someone, you're probably going to go to Payne Haas rather than Jack Goz. So it's been an epic sort of start to the season there. Just his work rate is just insane, isn't it? Like not even on the weekend, just gone, played 71 minutes, only 28 tackles, and, he's got 38 worth of runs in there. So, like, it's not a stupidly high tackle count either, is it? When you think about, the amount of minutes that he played there. But he's just on a different level fitness-wise to the rest of the boys in that game. Like, everyone else, looking around, looking for someone else to do the business, Payne Haas just goes, yeah, just give it to me. I'll just do it. And it was just insane. I've like, at the end, because I didn't obviously trade him in, I was, like, on the couch, and I remember, like, my wife was, like, tapping away on the computer. And I remember just seeing him go over, and I was like, that dude's a freak. And then she's like, you haven't said anything for 70 minutes and you say that now. I was like, yeah, but seriously, look at this thing. Like, unbelievable. She's like, yeah, he's a big unit.
Yeah.
He's doing the business. And honestly, credit to him with all the other stuff he's got on off the field as well with the family. Like, pretty special stuff. Pretty special stuff.
Yeah, mate. I think that's one, as much as we like to pump our own tires up, I will absolutely take the fall there. I said he was one who I was staying away from because he had that ankle surgery like 4 or 5 weeks out. So I didn't start with him. I didn't draft him in any comps. So yeah, definitely one I got wrong there. But mate, happy to be wrong. Sit back and watch the big boy. Yeah, as you said, do his thing. Here's where my head goes with it is seeing what Payne is doing now, just kind of given the freedom to offload, and whether this next player just didn't have the ability, but I think he would have. It kind of made me think a lot of like, man, I think the Cows might have missed a trick a little bit with Jason Taumalolo. And I know that's like such a hot take because Taumalolo is so good. Like, he's one of the best 13s like ever, right? But the thing that's always been against him is he just hasn't had that second phase play, right? And I'm like, I wonder if a coach had to come in and just been like, hey, Jason, we're going to work this off season on your offload. And maybe they did, and he was just shit. I don't know.
Maybe it's just like a directive, just throw 5 or 6 a game, and I don't care. We'll live with it. Yeah.
Yeah, 100%. It just makes me think, could Taumalolo have been even better? That's where my brain goes, sitting alone on the couch at like 10 o'clock at night after watching the Broncos get a good win. But great week of footy. Supercoach is going well, mate. We're both dealing with fires, but how good. It's good to have Supercoach back. We're only 3 weeks in. I know there's a lot of people talking about delete app and all this kind of stuff. Come on, guys. It's awesome.
It's fun.
We're all ranked in like the 20 to 50,000. Just deal with it. Just keep like my big thing, which I know we say all the time. Just get your heart picks, boys. Like,
call your shots. Yeah. Call them.
Yeah. Just find someone who you like and just get them in. And if they score 3 tries, you'll be laughing. So guys, that's a wrap for this week. If you like the pod, give us a review, recommend to a friend, all those things. James, thank you for being here. And as always, up the mighty, mighty Redcliffe Dolphins.